was really hesitant about it because like they couldn't tell us a lot about it. At least I didn't feel like they could tell us a lot about it. And so I felt like it came out too quickly. But of course, I wasn't educated enough to know much about it. I was just really hesitant.
I didn't get it the first time the Army offered. I was still reading about it, just doing a double take to make sure that it was safe, that it was moral, that it was ethical. And I came to the conclusion that the benefits outweighed the risks.
When the vaccine first came out, I wasn't very trusting at first. It came out not super fast, but it was pretty quick in terms of like other vaccines that came out before for other things. So I was scared and hesitant to get it at first. That's how I was feeling.
Oh, super relieved. I don't think anybody in the healthcare profession knew that we were going to have such hesitancy with the vaccine, but unfortunately with all sorts of communication methods and social media that's out there, so much information is coming from different sources, whereas 20 years ago, people got their medical information from their docs, from their healthcare providers. And so now the onus is on the actual patient to get the information or understand the information which they haven't been trained. So, we talk about as, did you Dr. Google this? Did you, do something to look up on the internet all the medical information? So that has made it very difficult for us. We're having to spend extra time with patients to explain really what the scientific information is out there and help them make more informed choices about their own health care.
Colonel Pearson and I have offered opportunities to the battalions to give briefings to help to inform them correctly and have a free dialogue between us so that they are clear and we can give them source documents in places where they can find legitimate information so that they can not only educate themselves, but as extenders of medical care, be able to educate their soldiers when they get down to the areas where they're going to be functioning as some of the military's most awesome medical support systems.
As our training progressed, I realized more and more on why vaccines are important, and that kind of helped push me to get the vaccine.
When I came here and started learning more about the job I was going to be doing, working around sick people and things like that, just medical in general, I felt it was better for not only my safety, but patients and casualties that I'd be taken care of just to get it. I mean, it doesn't take anything away from you. So
I think it came down to having a father who's aging, and he got the vaccine, and I'm here for Dad, so I'll do it for Dad.
It's really interesting to me, some of the reasons why people are deciding not to take the shot. Most of it is mis or disinformation or things that were passed down, kind of like the telephone game when we were younger. It just gets passed down and it's just simply not true. But yet, I'm the emergency room provider they come to see, and when they're really sick, and like I said, this is the pandemic of the unvaccinated, we're gonna throw the kitchen sink at them. I mean, this is their life.
Well, first I would want to know their why, because I think that once we kind of let them know that, first of all, I'm not attacking you, I'm not trying to force you to do anything, but I want to understand your why. Why is it that you're reluctant? And then once I know the why, based on what that is, I can address that. And I can, again, give them the source documents that can help them to feel more comfortable about making the decision, not just for themselves, but for their community, for their loved ones, and for the folks that they're going to be working with. Even with having mild symptoms in the beginning, let's not forget, it's a process. So although you're starting with mild symptoms or no symptoms, those symptoms can quickly escalate to something that can be significantly worse, that can land you in the emergency room or in the ICU.
I was talking to my dad about it too, because his job is making it mandatory for him to get it, and he's been asking me questions, and I've been not really pushing, but I'm trying to encourage. I'm trying to be an example to him that it's not a bad vaccine, that he should definitely get it, not for his safety, but as my family's safety as well. And that's kind of what I'm doing as well.
Don't be scared to do something that's going to better yourself and others. because I was in that same spot. I read all the news and all the things that people were saying, this could happen or this could happen. But, I saw my battle buddies getting it done. I got the vaccine, and, it's nothing bad has happened to me.
Get it. It's still effective. Vaccines work. There's been this hesitation to get vaccines for over 100 years before that inoculation. We're always improving science, and we're always working, and it helps me to get back to work.